Thanks for joining us. It's time for House Calls. Dr. Russell Walker is here to answer your asthma and allergy questions at 756-1212. 756-1212 is the number to call. If you have questions, hop on the phone lines. Lots of folks suffering right now.
That pollen count was incredible this spring. It's been unreal.
Horrible. Yeah, and now it's down, but folks are still suffering.
Yes. It's funny, I've had a lot of problems this year. People complaining of their eyes has been the biggest complaint with the pollen, and I think it's even people who don't have allergies because it's just so much grit in the air. It's like running around in dust the whole time. So I've had a lot of people coming in with big problems with their eyes, and then also sinus and nasal symptoms as well.
How do you know you need to see the doctor, that it's gone beyond just feeling uncomfortable during the day?
Because, you know, a lot of those people just do use some of the over-the-counter remedies and things like that. But if you've gone several days without any, improvement with that, that's when you need to go in and see your doctor and see if you need some help. And it's more than just something you can take care of at home.
Let's go to the phone lines where Ruth is our first caller. Hi, Ruth.
Hey.
How can we help you?
Okay, I suffer with sinus.
Right.
And, this probably is something else.
Has it been a problem for a while, like more than a week or so? Have you been having trouble with your sinuses for a while?
Uh-huh.
Well, if you've done that for a while, the things that we recommend a lot of times is using the salt water to use in your nose. That helps a lot. And then also go ahead, and if it's bothering you for more than a week or so, you probably ought to see your primary care doctor to see if you need an antibiotic for that.
Let's go to the phone lines now where Michelle is joining us. Hi, Michelle.
Hi there. He actually was just talking about my question.
Okay. So have you been having the same problem for a while?
Well, actually, my question was about using like the neti pot with the saline solution.
I love using the salt water and the saline. It's one of the best things that I recommend for all my patients. I start that even before I'll start some of the prescription medications.
I mean, how much is too much? I mean,
there's probably not a good answer for that. I tell people to use it at least once a day or sometimes twice a day. You can't overuse it really because it does help your nose and it's not a medication, so you can use it as much as you want to.
And it's cheap.
It's cheap, exactly.
756-1212 is the number to call if you have questions about asthma or allergies, 756-1212. And for folks that have asthma, they need to really be careful this time of year, right?
They do. We have a lot of people who have had problems with that because anytime your nasal symptoms flare up, it can flare your asthma symptoms up as well. So those people are at more risk of having sort of life-threatening symptoms. So those people do need to watch their symptoms closely. If they have peak flow meters, monitor those on a daily basis and be sure they're taking their controller medications on a daily basis so they don't get in trouble.
Let's go to David now. Hi, David. Welcome to the program.
Thank you. I have COPD. And I found that when the pollen's higher, I have to use my nasal inhaler and also my bronchial inhaler more often.
That's true. So
on the prescription, is that harmful to have to use it more often?
Well, if it's not harmful to use it more often, but if you're needing it more often, you do need to probably see your primary care doctor because there could be other things that are going on. So if you're using it more than regular for just a day or two, that's fine. But if it continues for longer than that and you don't feel like you're getting relief, you probably should go in and see your doctor because oftentimes we need help with antibiotics, and I've had to use steroids with people, so there are other things that may need to be looked at if you're having trouble more than just for a day or two.
Let's go to Lanisa now. She's our last caller. Hi, Lanisa. And I think we just lost her.
Okay.
I want to thank you for joining us today and put the information on the screen for you now. If you have asthma or allergy questions, you can always give Dr. Russell Walker a call, and he'll be happy to help you. He's on Gun Barrel Road, 499-4100. Get you more information or an appointment, 499-4100. You need to remember to talk to your physician before making any health care changes. Thanks for joining us.
Thanks, Rachel.
Appreciate it. Stay with us. We'll take a short break, and we'll be right back.